My name is Alyssa McCarthy. I'm going to be performing the IV insertion, so I'm just going to scan the room. So now I'm just going to set up my computer where y'all can see everything. Okay, so the first thing I would do is before I walked into the room, I would verify the hospital policy. And then when I walked into the room, I would introduce myself to the patient and perform hand hygiene. I'm going to identify the patient per the patient order form. So we have Jaguar Jones, birthday 8/25 in 1963, birthday 8/25, 1963. His allergies are penicillin and allergies are penicillin. Do you have any other allergies? No? Okay. And we do have an order for insert saline lock and AM for CT scan. So I'm just going to put this to the side because we have the right patient and the right order. And now I would make sure throughout the procedure I was providing the patient with privacy. And so I'm going to position my trash can, which is right here. Going to position that, and then I would perform hand hygiene. And now I'm going to put on my goggles. And I would raise the bed to a working height while lowering the side rails. The patient could be in a supine or a sitting position. And now I'm going to open all my packages using the sterile technique. Okay, and now that I did that, I'm going to take my alcohol swab I'm going to take my saline lock and I'm going to clean the white part, the cap. And after I clean that, I'm going to take my saline, I'm going to remove this cap, and I'm going to insert this, making sure it's tightly on there. And now I'm also going to prime it. Okay, and then prime it, you just let the water go through it. And now I'm going to loosen this cap so it's easier for me to take it off later. Now I'm going to replace this back into its container. And so now I would place a waterproof pad underneath the patient's arm, but I do not have one. And so now I'm going to, I wouldn't put the pad yet. First, I would select a vein. So when I select a vein, you want to choose the most distal part of the arm. You want to choose it in the non-dominant arm, and you want to choose a large vein that is like soft. And for fostering venous dissension, you can stroke the vein lightly, you can apply warmth for vasodilation, or you could have the patient put his extremity in a dependent position. And so now at this point, I would place a waterproof pad underneath the patient's arm, but I do not have one, but in a hospital setting, it would be a waterproof pad underneath the arm. And so now I'm going to place my torquette. So I'm just going to take this, and you want to place this 5 to 6 inches above the vein you chose. So I'm just going to put this on. Okay, and now that I have that on, I'm going to assess the vein to make sure it's appropriate. So I can just look at it, I can palpate it, and I'm also going to check the radial pulse. Okay, and now I'm going to apply clean gloves. And then after I apply these clean gloves, I'm going to move the saline lock closer to me so it's closer to the patient and easier. And before I do that, I'm going to prep 3 pieces of tape that I will use later on. Okay, so I have my tape prep. So yeah, I'll remove the saline lock closer, and then now I'm going to clean the site. So when I clean the site, I'm going to use chlorhexidine, and I'm going to just scrub it, and you want to scrub it for at least 30 seconds. So and then you would do that for at least 30 seconds, and then I would allow it to completely dry. And so now I'm going to take my needle, I'm going to take it out of the cap. So it is out of the cap, and now I'm going to anchor the vein. So to anchor that, I'm going to do it 1.5 to 2 inches below the insertion site, and I'm going to do that by stretching out the skin, by stretching the skin against the direction of the insertion site. So I'm just going to pull it like that, and then I would advise the patient to remain still and that there's just going to be a quick stick. And when you insert, you want to do it with the bevel up, and you want to do it at a 10 to 30 degree angle parallel to the vein. So I'm just going to insert that. And then once you get blood return, you are going to lower the needle and advance just the catheter 1/4 inch. So you want to stabilize the needle while you do just the catheter. And then once you do that, you're going to keep holding the skin, and you're going to advance the catheter all the way to the hub without advancing the needle. So I'm just going to do that. Okay, and now that I have that, I'm going to stabilize the catheter, and I'm going to release this. Okay, and then now that I have that released, I'm going to apply gentle firm pressure 1 1/4 inch above the insertion site. So I'm just going to apply pressure, and then I'm going to remove the needle, and then I'm going to place the needles in a sharps container, which I do have right here. So I put it in the sharps container, and now I'm going to take my saline lock, and then I'm going to remove the cap, and then I'm going to attach it tightly to this. So now that it is tightly attached, I'm going to use temporary tape to stabilize it. I have the tape on. And so now at this point, I'm going to I'm going to aspirate for a blood return in this. So I would pull back and aspirate for a blood return. And then I would flush the vein with the remaining saline, but since this is a noodle, I'm not going to actually flush it, but I would just slowly insert the saline and allow it to flush the vein. And so when I do that, I want to observe the site for any swelling. And so once I finish flushing, I would disconnect this, and I'm going to dispose of this in the sharps container, which I have right here. And so now that I disposed of that, I'm going to apply a sterile dressing, which I have right here. And when you apply the sterile dressing, you want to make sure that you put the dressing up just to the hub of the catheter. So I'm going to remove this. And put that on and make sure it is tightly on there. And now I'm going to remove the white part, and I'm going to make sure all the edges are tightly stuck to the arm. And then now I'm going to secure the tubing. So I'm going to remove this temporary tape. is I'm going to take another piece of tape and I'm going to take this and do that. Okay, and so now that I have that, I would dispose of all my equipment. I'm going to remove my gloves. I'll perform hand hygiene. And then what I'm going to do is I take this off of the sterile dressing and I'm going to I would write the date, the time, the gauge of the needle and my initials, and I just put it right there on the edge of the dressing. And so now I could reposition the patient. I would reposition the patient comfortably. I would lower the bed back down, raise the side rails. I would instruct the patient of how to prevent dislodging the IV. And so for this, it would be just to protect the IV when you're moving. Make sure you take the IV. If you are connected to an IV pole, make sure you take the IV pole with you. Don't walk too far away from it. And then I would also teach him about signs and symptoms of complication. And that would be infiltration, phlebitis, inflammation. If there's any blood in the tubing or the fluid stop, he needs to inform someone. I would perform hand hygiene, and I would document the date, the time, and the location of the insertion and how many attempts it took me to get the catheter in. And I would document the catheter gauge, the length, and how the patient tolerated the procedure, and the presence of a saline lock or flow rate or any method of, or the type of method of infiltration. So now that I've finished that, I'm just going to hold this up closer to the camera so you can see. Okay, and so now that I did that, I am now going to discontinue. And so I already have my goggles on, and I'm going to put a new pair of clean gloves on. And once again, I would raise the bed back up to a working height and lower the side rails. And I would perform hand hygiene and then put my clean gloves on. And then I would place another towel, a waterproof towel, underneath the patient's arm. So I'm just going to act like I place it underneath the arm. And so now that I did that, I am going to take off the sterile dressing. So when you take it off, you want to pull it towards the insertion site. So I'm just going to be sure I do that. And then I can throw this away, maybe. And so now I'm going to take this tape off. Making sure not to just pull this out, so steadying that. And so now I'm going to take my gauze, which I have here, and I'm going to fold it, and I'm going to apply pressure just above the insertion site. So I'm going to put that in, I'm going to apply pressure. And then now I'm going to withdraw the catheter. You want to do it slow and steadily. And so once I do that, and when I do that, I want to keep the hub parallel to the skin. And then now I'm just going to remove this. And then apply pressure, and then I want to observe the intactness of the catheter tip, and then I'm going to dispose of this in the sharps container. And then I'm going to observe for any complications and signs. I would just look at the injection site. Signs and symptoms of complications would be redness, pain, tenderness, swelling, bleeding, or any drainage. And you want to apply pressure for at least 30 seconds to stop the bleeding. And some patients may require more time. And so with that, I'm going to put the tape and keep that there, and it just applies pressure. And now I'm going to remove my gloves. I would perform hand hygiene, dispose of all my equipment. I would lower the bed all the way back down and raise the side rails back up and make sure that the patient was comfortable.